One of the most important programs at Community Action Partnership of San Luis Obispo, California is Head Start and Early Head Start. And today we have the director of that program, Debbie Welch, with us. Welcome, Debbie.
Thank you.
Now, I understand that this is the hub of activity for Community Action Partnership San Luis Obispo. Can you tell me a little bit about the Head Start, Early Head Start program?
I'd love to.
Great.
I've been very fortunate over the years to have so many success stories and to be part of changing so many lives. And one of the aspects of the Head Start and the Early Head Start program that sets the program, the child development program, aside from any other program is the comprehensive services that we offer.
And what do you mean by comprehensive services? What is that?
Well, beyond the academic, the physical, the social, the emotional, we also have a full parent involvement center where the child is the focal point, but it's the hub around is the family, and so it's focused on the entire family.
That sounds really comprehensive. Child in the center, family, community, all together supporting the success of Early Head Start and Head Start children. That's a wonderful part of the program. Now, can you describe some of the other features of the program that you have?
Each child, as they enter, they're given they have a physical and a lead testing. We have each child, we set them up with a medical home if they don't have a medical home already.
Debbie, what is a medical home?
A medical home, it would be consistent services, a continuity of services for the family, an actual doctor's office that they could build a rapport with and that they would be going to on ongoing treatment far beyond Head Start, making sure that all of their immunizations are completed.
Oh, that's so important.
And with that aligns our dental program. We just, for instance, we just had a dental van last week go out to all of our centers, and every child got a dental examination, and last year 100% of our children got the follow-up treatment that they needed before they went on to kindergarten.
It's so important to get follow-up treatment, and you're actually sending the medical care out to the Head Start program so the children don't have to travel or go to the service. Oh, that's wonderful.
Yes, for the convenience of the families and children.
And what other kinds of health-related services might you include? Like nutrition, is that an important part?
Nutrition, the children are given balanced, nutritious meals every day.
Now, if I have a child in Head Start who might have a special need, how might you address special needs?
We have a disabilities program, and actually 10% of our children minimum have disabilities.
Really?
And then we have, of course, there's many special needs. We often have children who are referred to us from the court system or foster home, and we help foster parents prepare, and it's just an extra support.
Great, that's wonderful. Now, you've brought a special guest with you today, and I'm anxious to meet her and understand her Head Start story.
Yes, like I said earlier, you know, comprehensive, the holistic services, and that's starting with pregnant women, and it's birth through age 5. So Angelina has a wonderful story to share.
Well, Angelina, welcome.
Thank you.
Now, how did you begin your Head Start journey?
Well, I began since I was 3 years old. I was in the Head Start program.
So you were a Head Start child?
Yes.
What was that like for you?
It was fun. You know, I remember the playground. I loved the teacher.
So tell me, how did you get re-involved with Head Start?
Well, when I was a teen parent, I got pregnant, and the first thing that came to my mind was Head Start, because that's where, you know, I went, and since I had a good experience, I didn't think about it. You know, I put my child in there, and I knew he was going to be good.
So you knew right off that your son could take advantage of Head Start and that he would be ready to enter school.
Yes.
And how did that work for him?
He did great. I mean, it was a very easy transition when he started kindergarten.
And then later, how did you continue your involvement with Head Start? Because I understand you're involved with Head Start now.
Yes, I am. Well, after he did the program, I like I like the program how it works, so I got involved. After I graduated, from high school, when I finished my education, I decided that I was going to go in that field because I love it. I love working with kids.
And so you were involved as a parent because he was now a student in Head Start.
Yes.
And you reconnected with the organization. And did you then become more than a volunteer and parent involved?
Yes.
And what was that?
I love, I just love, every day was a new day, new activities, and you just see the kids grow, every
So
day.
you became an employee at
Yes.
some point working in the classroom, and what job did you have then?
First, I started as an assistant, then I moved up to a teacher. I always work with the little ones. Yeah.
And what ages were the little ones?
They're 6 weeks to
Oh, babies.
babies.
Oh,
so it's just
wonderful.
like cuddling,
Yes. I understand that the Recovery Act has touched your life. What has
Yes.
happened now where the Recovery Act has helped you?
Well, they give us the opportunity to finish, my education and getting my bachelor's,
So you're a teacher in Head Start. You've met those qualifications, and you're moving on to your bachelor's degree?
Yes.
What school are you enrolled in?
And La Verne University.
Wonderful.
Yes.
And so the Recovery Act has brought resources to community action to assist a Head Start teacher move on in her career and her education?
Yes, actually, Laverne has come to our facility, to our administration building. So our teachers come there, and they're a cohort. So we have 2 classrooms going at this time.
Wow, that is a wonderful story of long-term success touching several generations and leading into the future through Head Start. Thank you so much for joining us. Community action, early Head Start, and Head Start, helping people and changing lives.